What's up, everybody? I wanted to talk about a couple personal topics, things that I've dealt with personally in the past. Don't get talked about very much. First thing is suicide or suicidal ideations. I've had my own in the past. I've dealt with and struggled with those myself, and I can tell you from personal experience that people react to that differently when you tell them. I've gotten different reactions from different people, but I get anger a lot. Close friends, family, I would tell them, wanting them to listen, just wanting somebody to talk to about what I was going through, and they kind of reacted to what I said out of anger, and they'd say stuff like, "You got a family," or something like that, and it's like, wow, you know what? I forgot. I'm glad you reminded me of that, because I just forgot. I'm so glad we talked. I feel so much better. And it's not like it only affects people without families. It affects people with families, without families, rich, poor, young, old, the famous and the obscure. It doesn't really matter. The thing about reacting to it that way, I mainly want this to be an informative video. I don't want to rant or anything, but I think if we try to talk to those people instead of reacting to what they say, ask them, why are you feeling that way? Why would you want to do that? And don't say that out of anger. Say that out of concern or love. And I think the thing about reacting to it out of anger is they'll never want to talk to you about it again. They might finish that conversation with you, but they'll never open up to you about anything else again. I know from experience, because I've dealt with that. And instead of doing that, ask them what are they going through? What are you going through? I want to know. And that would be much more effective than trying to guilt them out of what they're thinking about doing. The other thing I wanted to talk about real quick is bipolar disorder. A lot of people have it. Not a lot of people know about it. It's kind of thrown around like the word crazy or retarded. Bipolar people are not crazy. They have a chemical imbalance in the brain. For those of you that don't know about bipolar, it's caused by a chemical imbalance in the brain. There's 3 chemicals in the brain that regulate emotion. There's serotonin, norepinephrine, and dopamine. Bipolar affects norepinephrine and serotonin. And it's not that they're crazy, or most of the time. They might act crazy, but they can't control how they feel. They go high and then they go low, and they can't control that. And some people don't know that they've got it. Some people go their whole lives without knowing, and they live a miserable existence. And to those of you that that throw it around like the word crazy, you should know I have bipolar. I don't advertise that. I don't tell everybody, hey, I've got bipolar, how you doing? But I have it. I wish I didn't. But it's something I have to live with. It's something that my family has to live with. And we've all got to deal with it. There's a huge stigma. It's like a huge elephant in the room where mental disorders and mental health is concerned. And people are very ashamed to have anything like that. They don't want to tell anybody because people will think they're crazy. And I'm guilty of it too. Before I knew I had bipolar, you know, I would say someone's acting bipolar, like they were being crazy. But it's not that people are crazy. It's just they can't control it. They can't. It's hard to explain to people that don't have it what it feels like, but you have two different types of bipolar. There's bipolar 1 and bipolar 2, and it can be mixed with other disorders as well, like schizophrenia, and that is similar to bipolar in that it's affected by chemicals in the brain. It's only different chemicals. I won't touch on that though because I don't know much about it. But you have what's called mania, and you have depression. And mania is the high side, and depression is the low side. And people that are manic do risky stuff like drugs. They might have risky sexual behavior, or just doing what others consider to be very risky behavior. You know, might jump off the roof or something because they felt like it. But then you have depression. They might seem down or angry sometimes. And a lot of times that's kind of how bipolar is viewed. They see the anger side. That's kind of the ugly face of it. And to someone that's not treated for it, it's very hard to deal with. It really is. And again, I know that from experience. I have bipolar again. And it's not something that you can choose to have or not have. It's passed down through genetics. And a lot of people have it. There's millions of people out there that have it, and probably a lot more that don't know that they have it. And it just makes you wonder how many people have committed suicide because they can't deal with what they're going through, and they have bipolar, or to touch on what I was talking about earlier, they may have tried to tell somebody about what they were feeling, and they got that angry reaction that I was talking about, and never told anybody, and didn't feel like they could tell anybody about what they were going through. So I urge all my friends, especially if you know someone that has bipolar or is going through depression, and you do know someone, you know me, educate yourself on the disorder. It's more common than you think. And next time someone tells you that they're having suicidal ideations, talk to them. that could save their life. Thanks for watching.